So, Dr. Howard, give us your top three tips on how to be an excellent mentee.
So that is a great question. I think my top three tips for being an excellent mentee. Tip number one is to really take ownership of whatever you're working on with your mentors. I often talk to medical students who may feel that they are at the bottom of the totem pole on a project. And I remind them that they often are the most engaged in the project. They're the ones doing a chart review or administering surveys to patients or talking to staff about a quality improvement initiative. So I think taking ownership makes you very effective. My second tip is something one of my first mentors ever told me. And she said, Ryan, every time we meet, I want you to have something, for that meeting. And even if there was no updates on a project, the point was that I have this incredible resource, come to these meetings ready to engage your mentor, get advice on career, get advice on projects, share new ideas. And again, I think just not being passive and really taking advantage of this valuable time. And then the third top tip I would have is really, I guess, realizing how you can use your mentor's strengths. We have the privilege of working with, faculty who have been through what we're going through. They have incredible wisdom on the projects we're working on. They have incredible connections. And I think sometimes as a trainee, you may feel like your reach is limited or your capabilities are limited. And that's, I think, when you can turn to your mentor and kind of brainstorm together, how are we going to accomplish this? How are we going to drive this project forward? So those would be my top three tips.